What is the best stool test for gut health problems? Imagine peering inside your digestive system without invasive procedures. That's what stool testing offers. If you're experiencing bloating, gas, irregular bowel movements, or food sensitivities, understanding what's happening inside can be a game changer. But with so many options out there, how do you pick the right test? Let's explore the different types and what they can tell you about your gut health. Stool tests analyze a small sample of your feces to find signs of imbalance, infection, inflammation, or damage to your gut lining. They can identify bacteria, yeast, parasites, and markers that show if your gut barrier is compromised, like in leaky gut syndrome. These tests help pinpoint the root causes of your symptoms and guide personalized treatment plans. There are a few main types of stool tests. Culture-based tests grow bacteria from your stool in a lab, but they often miss microbes that don't grow well outside the body. Polymerase chain reaction tests, or PCR tests, detect the DNA of specific microbes, making them more accurate and able to identify a wider range of pathogens. Metagenomic sequencing is an advanced method that reads all the DNA in your stool, giving a detailed picture of bacteria, viruses, fungi, and more, down to the species level. Metatranscriptomic tests go even further by analyzing which genes are active, showing what the microbes are actually doing in your gut. Some of the most popular and effective stool tests include the Viome, which uses PCR technology to detect a broad spectrum of pathogens, bacteria, parasites, and inflammation markers. It's especially helpful if you have ongoing digestive issues and want to find hidden infections or imbalances. The results guide targeted treatments like probiotics, dietary changes, or medications. Viome is another option that uses metatranscriptomics to analyze microbial activity, not just presence. It provides personalized food recommendations based on how your microbes are functioning, which can help you adjust your diet for better gut health. Then there are comprehensive tests like GI-Effects and GI-360. These combine PCR and culture methods to give detailed reports on bacteria, yeast, parasites, and markers of digestion and inflammation. They are often used by healthcare providers to diagnose dysbiosis or leaky gut. Gut360 is another test that uses DNA sequencing to assess over 30 gut health markers, including food sensitivities and microbial balance, often with a consultation to help interpret your results. Tiny Health offers microbiome profiles tailored to different age groups, making it a good choice for families or individuals at various life stages. When choosing a stool test, think about your symptoms. If you have chronic or severe issues, a test like Viome or GI-Effects might be best because they screen for infections and inflammation. If you're generally healthy but want to optimize your gut, a broader microbiome test like Viome can give you personalized insights. Technology matters too. Metagenomic and metatranscriptomic tests provide detailed information but can be pricier and more data-heavy. PCR tests are often sufficient for most common imbalances and infections. Look for tests that give clear, easy-to-understand reports with practical advice. Some include consultations with health professionals to help you interpret the results and plan next steps. Cost and availability vary, so consider whether you want to order directly or through a healthcare provider. Once you get your results, work with a healthcare provider or nutritionist to create a plan. This might involve dietary changes like adding probiotics, prebiotics, fermented foods, or bone broth. Supplements such as targeted probiotics or anti-inflammatory herbs can also help. Lifestyle factors like managing stress, improving sleep, and staying active support your gut recovery. Repeating the test after some time can show you how your changes are working and guide further adjustments. Keep in mind that stool tests are tools, not definitive diagnoses. They provide a snapshot of your gut environment but should be used alongside your overall health picture. The science of the microbiome is still evolving, but these tests can be very helpful in identifying imbalances and guiding personalized strategies to improve digestion, reduce inflammation, and boost your overall well-being. The best test for you depends on your specific needs, symptoms, and goals. For many, a comprehensive PCR-based test like GMAP or GEFX offers a good balance of detail and practicality. If you're interested in the latest science and personalized nutrition, a metatranscriptomic test like Viome might be worth exploring. Whatever you choose, use the results as a starting point to make informed, practical changes that support your gut health.